Dr. Michael Wheeler, orthopedic spine surgeon. We're going to continue talking about different tests. So far, we've covered x-rays and MRIs. Now we're going to get into the world of CT scans. CT scans, these are the highest quality study to evaluate fine detail from a bony level standpoint. So I think of a CT scan as something that is extremely useful in my practice. If somebody's had previous surgery in the spine, whether it's a previous decompression or a clean out, or they've had previous hardware put in the spine, the CT scan is going to be by far the gold standard to evaluate exactly what was done, where the surgeon had been, where the hardware was placed, and gives us the best kind of roadmap if we're having to plan any sort of revision surgery. A lot of other things can be gleaned from a CT scan. Number one, and super importantly, is did the bone heal? Okay, whether this is general orthopedics and you're talking about a broken arm or a broken leg, or in the spine where there's been either a fracture or a previous surgery to try and get the bone to grow together like a fusion, the CT scan is going to be the study that's going to evaluate how successfully did those bones knit together. The CT scan is also extremely useful for evaluating, is there any sort of loosening of the hardware? That oftentimes will not show up at all on an MRI, and sometimes won't show up on an x-ray unless the loosening is quite extreme. Other things that a CT scan can show us is bone density, and this is going to be super important right now and also going forward as the aging population continues, is how dense is the actual bone itself? CT scans allow us to use what we call Hounsfield units, or HUs, to evaluate how strong an individual bone may be and gives us an idea of sort of a fracture or failure rate if we're going to have to put hardware within the spine itself. So CT scans are extremely useful for evaluating fine bony detail in the revision setting, or if you're worried about bone quality, or you're just trying to plan exactly what was done in a previous surgery, CT scans are going to be super important in that situation.